This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, and actually we're right across the street from the main hospital, standing in the Bariatric Center. Now, if you're somebody that's dealing with obesity and it's really starting to affect your lifestyle and your health, this might be the place you want to seek out. Today we're going to be talking about bariatric surgery with bariatric surgeon Dr. James Kemmerling. Well, thank you for taking some time with us today. Just trying to learn a little bit more about bariatrics and what it is that you do so well.
Well, I'm a bariatric surgeon, and I help people lose weight. As you know, being overweight is a terrible affliction, and it's affecting many, many people in the United States and basically in all the industrialized societies throughout the world. As our weight goes up, it diminishes our ability to enjoy life. It leads to other conditions like diabetes, high blood pressure, bad knees. And these are difficult conditions to address until we get our weight lower. So what we offer is a surgical option to help people lose weight.
Is a surgical option the immediate option for people, or is that something that kind of comes along in time?
Yes, that's a very good question, because usually when people come to see me, they have tried every diet under the sun. And they're basically desperate to get some help to get their life back. So we're not talking about somebody who's just trying to lose weight for the first time. We're usually talking about people who at this point need a little help. And so the surgical option is a way to get somebody back to a healthy weight.
Who then becomes a candidate for that type of surgery?
Well, there's actually guidelines that were established by the National Institute of Health. And basically they use a number that's called a body mass index, BMI for short. Now, if you say you're 200 pounds, it makes a big difference if you're 6 foot or 4 foot. So in order to talk about weight, we divide the weight by the height squared. We use metric units. And that gives us a way to talk about somebody's weight in relation to their height. Now, a healthy body mass index is 25. If you're over 40 for your body mass index, those are people who could consider surgery as a treatment option. Now, if they have a body mass index 35 to 40, if they have a health condition along with that, they might also be a candidate.
So if you're in a situation where your BMI is over the top where it should be, does that person then become a candidate for these surgeries?
Well, that's a good question. At that point, this might be somebody who's considering the option. And then what we do is we meet with people and we look at their medical condition. There is an insurance requirement in most cases. Now, if somebody comes in to see us, we actually check on their insurance coverage even before they come in. And a lot of times they'll have like a list of requirements that have to be met before they'll authorize the payment. We help people with that. We make it as easy as possible for them to get through the process. We don't want there to be a barrier to people getting treatment if this is the option that they choose.
Are there a couple of different options surgically for patients?
Well, we offer 3 different procedures. One is called the Roux-en-Y gastric bypass. It involves making the stomach smaller using a stapler technique, and then we change the intestinal anatomy to decrease the amount of food that's absorbed into our bloodstream. As a result of this change in the anatomy, there's also another benefit, and that is a decrease in appetite that lasts for about a year to year and a half after the surgery. We call it the honeymoon period. So what you do is you get this jump start, this weight loss, almost whether you like it or not, and then at a year and a half, once you've gotten all this weight loss, you're highly motivated to keep that weight off because you never want it to come back. And typically we'll see 50 to 70% of the excess body weight loss. Now your excess weight is your current weight subtracting your ideal body weight. So we're not telling people they're necessarily going to get to their ideal body weight. They can if they become athletic, for example. But on the average, this is what we see, 50 to 70% of their excess weight.
Yeah, and you're going to be much more healthier after that, I would imagine, as well.
That's exactly right. I mean, and the biggest impact with the Roux-en-Y gastric bypass is a type 2 diabetic. Type 2 diabetes is a resistance to the effects of insulin. That resistance gets higher as our BMI gets higher. If our BMI gets lower, diabetes improves. But with the Roux-en-Y gastric bypass, as a result of the change in the intestinal anatomy, right after surgery, you have an increased sensitivity to the effects of insulin. So typically a type 2 diabetic who's not on insulin will go home off their medications after that surgery.
And I know there's a couple of other procedures as well?
Right, there's a procedure called the laparoscopic adjustable gastric band where we put a little band on the top of the stomach to restrict how quickly food goes through. And we also have a procedure called the laparoscopic gastric sleeve resection where we basically remove 85% of the volume of the stomach, leaving the person with a smaller stomach.
Okay. What type of risks are involved with a surgery like this?
Well, this is something that we go over in great detail. We have a seminar where people are informed regarding the procedures, what to expect after surgery, and we do go over the risks. Now, everything we do is aimed at making this a safe alternative for weight loss.
Yep. And how do I know which procedure is going to be best for me?
It's a personal choice. I mean, you got time to decide. I always tell people don't feel under pressure. And there's many different ways of looking at this. So when you come in to see us, we actually go over this as far as how it relates to you.
What's the best way for a person to start their journey to healthy weight?
Easy, easy, easy. Just call us. Come on in. I'm serious. You don't need a referral. You don't have to check with your insurance. We'll do that for you. And the whole idea is when you come in, if you're not a candidate, there's no charge for the visit. If you are a candidate, we can get the ball rolling and we will know what your insurance requires to get everything started.
Sounds like a great idea. Thanks for taking some time with us today.
No problem.
Now, if you're dealing with obesity or you know somebody who is, it's time to get some more information and get some help. You can visit our website at aurora.org to find out more about the seminars, or you can get a hold of Dr. Kemmerling by calling 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.